you're working. Do you have to take Medicare? The answer, of course, it depends. Depends on the size of your employer and whether or not they plan to continue providing healthcare coverage for you post age 65. If you're working for a small group employer, less than 20 employees, it's possible that you and your dependents, including a dependent spouse over the age of 65, could continue to have coverage on your small group health plan. However, it's not required for your small group employer to continue covering you post age 65. They can ask you to opt out of the coverage, and if they do, it's time to go get original Medicare A and B and a complete Medicare plan package. However, if your small group employer allows you to remain on the small group coverage, some things you'd want to consider is what is the price of that coverage, what are the benefits including with that coverage plan, and am I covering dependents? If your answer to the price is that it's reasonable and the coverage is good and you're covering dependents, there's a very good chance you're going to want to remain on that small group employer coverage until you retire down the road. However, if the answer to those questions is, hey, it's expensive and the benefits aren't that great and I'm not covering any dependents, you do have the option to opt out on your own if the overall package is more affordable for you under original Medicare. If you're working for large group employer coverage, large group is defined as 20 or more employees on the group health plan. The employer is not allowed to release you from plan coverage and are required to continue offering you the coverage post age 65 as long as you're still actively working. That would also apply to any dependents on your plan, including a dependent spouse that's Medicare eligible. It's as if they work for the employer themselves. Again, you always want to consider the cost of the coverage and the benefits and any dependents that you're covering, but it's very likely in a large group employer situation that the overall package may be better for you to remain with the employer group. It's always going to depend, and that's why we customize the search based on your needs and situation. So fast forward down the road, you've delayed taking Medicare and it's time to sign up. You're ready to retire. As a late retiree, as we call them, you'll have a special election period. It's 8 months from the time that you leave qualified employer coverage to take your A, B, or both without a penalty. This is going to involve enrolling in Medicare, typically online, and you want to be able to upload employer verification forms continuously from the time you are working post Medicare eligibility. So if you change between the employers along the way, post age 65, you'd want to get an employer verification form from each employer along the way and upload all of that with your application when you enroll in Medicare. It's very important to keep a paper trail because if you don't, it may show a gap in coverage and there could be delays or penalties in your coverage. So really, really important. You also want to make sure that you consider taking Medicare Part A right when you turn age 65. You don't have to take Part A, but most people do. As long as you've worked 10 years or 40 quarters paying into the Medicare line item on your paychecks, you're not going to pay again for Medicare Part A. That's the hospital portion of Medicare, and it usually doesn't have a premium for most people. If you're not contributing to a health savings account at work or an HSA, you're fine to take Part A. You'll have a Medicare number in place, and it just makes things easier down the road when it's time to sign up. However, if you are contributing to a health savings account at work and you are on qualified employer coverage, it's important to delay both A and B, because if you take A at the time of 65 and you want to contribute to your HSA, you won't be able to continue to do so if you take any part of Medicare. Now, if you're a person who's contributing to an HSA and delaying both A and B until you retire down the road, it's really important to note that when you take Part A later, they retroactive your effective date back 6 months. So for instance, let's say you go to apply for your Medicare in July 1st, 2025. The government's going to retroactive your Part A back to January 1st, 2025. And so for that reason, it's recommended to stop contributing to your HSA about 6 months prior to applying for Medicare Part A. The take-home message here is that if you delay taking your Medicare because you have qualified employer coverage, don't worry, you have an 8-month special enrollment window to take Medicare when you retire. You just want to make sure you do it within that 8-month window. Otherwise, you would face those delays or penalties down the road. For any more information, please don't hesitate to contact us. Thank you.